so we're gonna start going into first aid right now. So some of you might have actually had some first aid courses, type of stuff. Kind of cut the surface of first aid care. Obviously, as an AT, you'll probably get a little bit more involved with cleaning wounds and dressing wounds and those kind of things. Currently, we are not certified to give stitches, but hopefully, eventually, you start looking at those into your advanced classes, the advanced AT or advanced procedures for athletic training. You get to go through it and kind of learn how to give sutures. But right now, athletic trainers are not technically licensed to be able to do sutures ourselves. But hopefully with the master's program that we can start showing that, yeah, we're teaching it and showing them that they'll let us start giving suturing, because that would make some of our lives a lot easier. So if we got somebody in the basketball game or somebody at practice, oh, suture you up, okay, go ahead and go back out, which would be super nice. Otherwise, you got to hope that a team doc is at the game, wherever we're at, or you have to send them into acute care type of situation to get those done. But so we're gonna go start. I'm gonna kind of run through everything, and then we might need some extra skins for like when we do glue and steri strips, because then they'll be dry. Anyway, so I'll kind of go through everything that we'll need to do today. Then we'll kind of rotate. You'll get a practice, kind of go through those kind of things. So obviously I got some skins on a few stations. We got our fake blood up here. We got some gravel, so you can do some debridement, those kind of things. We got some steri strips, and we have some super glue so that we can practice gluing our lacerations together too. Okay. First one, obviously go through wound cleansing. So anytime you are doing any kind of first aid wound care, making sure you're doing your personal protective equipment, so your PPE. Always make sure you wash your hands, glove up, gown up, eyeglasses or eye goggles on, all that kind of stuff, especially if you're doing cleansing and debridement. Do you always see that in the athletic training room? No, but to follow proper procedures, anytime we're doing like cleansing, you're using your syringes, trying to clean out the area, you should have proper protection on so you don't get backsplash or anything that comes up into any open orifice. Makes sense? So actually today would probably be a good day to have your guys' face shields on. But yeah.
We haven't done that in a while.
No, we haven't done that in a long time. But no matter what type of first aid, so wash your hands, glove up, other personal protective equipment that you deem necessary, such as, like I said, gowns, eye protection, face shields, whatever it might be. Wound cleansing, go ahead and make sure you read through your panels. It's going to give you a whole bunch of numbers about the pressure and PSI that you're supposed to get through your either syringes, or like I said, you can have a bottle of saline solution or whatever it might be, because you have to have a certain amount of percentage or PSI to squirt into the area to be able to push out the dirt or dirt and whatever else that might be left into the skin. So make sure you kind of read through those on your portals. But today for debridement, for wound cleansing, try and use a saline solution or any type of tap water. Those are your first choices to try and do some wound cleansing. You can use gauze, whether it's sterile or non-sterile. I don't know if you pulled any.
Fully sterile.
Full sterile out. Okay. So making sure you always also know the difference between sterile and non-sterile. Turn it around. Is this stuff sterile or non-sterile? Non-sterile, because it's all in one giant package, and if I pull one out, I'm going to touch them all. Sterile gauze or sterile packaging is all individual usage, where you're pulling it open. It's like this is a sterile packaging. Okay, it's individually used. And I peel it and I pull it open, and this is the first time it's actually touching opening air. Okay, and also to be super, super technical, anytime you're touching an open wound, you should have sterile packaging. Do you always see it? No, because a lot of times we just grab the quickest gauze that's open and put it on the wound to try and cleanse it up. Like I said, always try and use a saline solution or some type of tap water. And then to cleanse it more thoroughly, if you need to use some type of antibacterial soap, those kind of things, then you can go ahead and use that. You can do a soak in a tub. So you can do like a whirlpool soak if you have a large area that needs to be cleaned. You can hop in the whirlpool, but your whirlpool has to be completely 100% sterilized. And then you usually have like either tablets or salts or something that you drop into it. It's like an antimicrobial, bacterial type of stuff that'll help cleanse the water in there and help cleanse the wounds. We will never use that because we do not have a 100% sanitary whirlpool. So,
And it's most important that your final step is when you get to the most sanitized situation. So, like if they're actively bleeding, unsterile gauze is fine to kind of go through. It's when you're finally sterilizing, especially if you're going to close anything in. Before you do strips or glue or whatever, you're trapping everything in there. So you need to make sure that that last step is sterile. Before then, you can re-sterilize it and re-clean it later.
Anything else about wound cleansing?
I don't think so.
Okay. And a lot of times you get an athlete that, they, especially our baseball, softball players, you got to be a lot more careful. Someone that gets cut, injured outside, that's when we get into more of our debridement and making sure everything is out of the wound. And a lot of times if I think it's okay, I'll just have the athlete go home and in the shower, usually the spray from the shower is going to be enough PSI to try and clean it out, get the debridement, get that top layer off. And even just their general body soap or whatever is going to be enough of a soap to clean the area too. So, and debridement techniques. So your first debridement is going to be through like a syringe or some type of tub. I should have grabbed we do have little cylinder bottles with a cap on it that has this pure saline solution, or we can use our nice syringes, pulling up with water and get enough PSI to be able to push out of there. Technically, we're supposed to be able to have, sorry, I'm moving around, a needle on there. We're not giving you guys needles quite yet. But depending on the width or the diameter of your needle, obviously the bigger the hole, the higher the pressure and the more water you're going to be able to spurt out of there. Okay. But honestly, even just working without the needle and being able to push through is going to be almost just as good to try and debridement out of there. Okay. So your first is going to try and take your saline or your water and try and wash it out of there naturally. If that's not working, you can take your gauze, typically preferably soaked with some water or something, patting it down to try and, or even wiping it, scrubbing it out type of situation. If that's still not working, then you can grab your other tools, such as your forceps or like some scissors that have like not a pointed end, so you're not cutting, but some gripping scissors, forceps, tweezers, to actually go in there and dig out what you need to. So you got pesky gravel that you can't quite get out of there. I find my forceps better with like fibers, either hair or fibers from sweatpants, pants, whatever it might be, that is not as easily to be able to rinse out with your water or soap. Okay, so you either have to scrub it off or you come in with your forceps and take each of those individual pieces off. Biggest thing is, like James said, try to make sure all of that debridement is out of there before you cover it up. Because if you leave any of that debridement, dirt, whatever else might be in there, could be cause for infection going on. So debridement. So wound dressing. We're just doing like basic wound dressing.
Yeah, basic. I mean, in the wound dressing thing, there's all sorts of craziness that gets in there as far as best healing practices and all that. Some sort of occlusive hydrocolloid something dressing helps it heal the best, like a moist environment in there. But most of the time that's for trying to maximize healing for long-term things. Most of the time we're more interested in short-term gains. So we're drying, keeping things. And so it's really just going to be some sort of non-stick pad, right? A sterile non-stick pad, and then some sort of adhesive. And that non-stick pad is just a big Band-Aid.
Yeah.
Really, and that's all you're really looking for.
And that's your biggest thing. Yeah, you don't want anything that's going to stick into the wound, especially if you have an abrasion. So you get, especially like this gauze. And actually, this is the good gauze. So this is non-moving sponge, so you can tell that this is a little bit smoother. You get some of our gauze that almost looks a little rougher in shape. All of a sudden, you stick that onto an adhesion. Next day, they're coming in, you need to change the wound. Those fibers are going to stick into into your abrasion. Okay.
So this is a,
Something up the camera. This is a sterile non-adhesive pad. This is probably your go-to for wound covering because it won't stick in there. This is just basically a big Band-Aid thing, and you can wrap that on with PowerFlex or whatever, but it will allow it to heal without sticking. The gauze will get caught in there, and when you take it off, will rip the scab off. So the big thing on wound things, in my opinion, with that is non-adhesive pad, not gauze. Or you can use gauze like to get you through if they're still bleeding and it's soaking and you're trying not to get caught by the officials. That's fine, but you need to get that off of there before it stops bleeding. Otherwise, as soon as you rip it off, they're going to start bleeding again.
So yeah, so the non-adherent,
Yeah.
so yeah, the non-adherent, so when you think of a general Band-Aid that you put on somebody, so that white piece in the middle, that's all that this is, just a giant or bigger piece, and we don't have the adhesiveness on the outside of it. So if you think, hey, you put on a Band-Aid, oh yeah, that middle white part soaks up the blood, but it doesn't stick to the wound. So non-adherent, so it's the exact same thing. It's almost a little slicky, so it's not going to stick into anything. It's not going to release any fibers into those wounds. We just don't have the adhesiveness around it. So anytime you're applying to the wound, you can use this. Then take your coverall roll on top of it, or you can just take PowerFlex, pre-wrap tape, whatever, then go around the body to make sure this does stay and attach to the area. Obviously, depending on the area that you have is where it's going to stick. On the arm, yes, I'm able to wrap around. Baseball, softball players, when they get their strawberries in the back of their leg, not as easily to try and take PowerFlex and wrap it all the way around. That's when I start using my coverall strip. So like that sticky tape we use for our Leuko tape in our knees. So that just goes over top. A lot of times that sticks actually pretty well on those types of areas. Okay.
Just since I'm playing in Jamie's old kit. So they sell like irrigation things like this, which is non-sterile, right? And it's at that right PSI when you squeeze it. It'll dry. Or they have like sterile versions of the same sort of thing that you can have. So like in this case, I just rip one of these off, pop the top off and squeeze that, but this is sterile irrigation solution.
There's one-time use,
Yeah.
where there's a multiple use, obviously non-sterile.
So in all reality, most of the time when you're using stuff, if you're doing it, you'll have something like this. It's not expensive. You know what I mean? You can just use sterile saline too in the bigger bottles. Usually you'll have that around.
But obviously everybody knows what a Band-Aid looks like, right? So I hope so. So those are our typical wound coverings. Band-Aid. So actually a Band-Aid is a name brand. It's an adhesive covering. So whatever. These are our occlusive dressings. We have these as our Novaderms. Okay, so I'm not going to open it up, but it's more like a gel pad. So this is going to be something that's going to keep the wound moist for a little longer to try and help heal basically underneath to the surface. I've only actually used these a couple times. The only times I have used it is I had a softball player that got really bad. It wasn't even from softball. She was rollerblading, hit a patch of gravel and wiped out and got, just road rash down her leg the day before a conference tournament. So, so we needed something to kind of keep it moist so it wouldn't harden up, so it wouldn't keep cracking and breaking open on her. So we actually used a couple patches of these. It's going to help with the healing too. Like I said, it's going to keep it moist a little bit longer, so it's going to help try and heal from the inside out. That's the only time I've ever used it. Usually when we have like those bigger abrasional type things that we're going to use these on. Okay. We do have different coverings too. Like I said here, this is called a transparent semi-permeable dressing. So I'll go ahead and open one of these up. A Band-Aid, but you're not going to have a lot of those outside edges. So I peel the back of it off first. A lot of times I will have like a small non-adherent Band-Aid cut in a corner, like at the size of my wound, gets placed on the wound. And also going to be kind of hard showing. But then the outer edge comes off. So it's sticking and it goes straight onto the skin without any edges. sticks actually pretty well, so I don't have to wrap any gauze or Powerflex or anything else, not gauze, but Powerflex or anything around it to be able to go on there. This guy is actually pretty waterproof, so if you have a swimmer, you could potentially put something on this on them that you're trying to keep the wound out. I used this on an athlete that, what was it? She had some type of cut on her foot, her ankle, and we were on a tournament trip down to, I think we were in South Carolina at Myrtle Beach or something. So we had a free day, wanted to go to the beach. We didn't want to get sand and everything into her wound. So I threw one of these on her and it kept dry, it kept clean, all that kind of stuff while we were able to, so she was able to enjoy a free day on the beach type of thing, but still be able to keep her protected and not get any kind of infection in there. That one. See if I can save it and you guys can kind of see it and play with it later. Yeah. So those are just a couple other examples of different types of dressings, band-aids, and stuff that we do keep in the AT room. Next is wound closure strips. So these are Steri strips you've probably seen. Secure strips. So Steri strips, I think once again is a name brand. Okay. These come in different widths. Depending on the size of the wound that you have. Once again, these are in sterile packages, but once you open it, then it's no longer sterile. So if you can kind of see, there's 1, 2, 3, 4, there's actually 5 strips on one package. Not many times are you going to use all 5 strips in the full length of the strips. So that's again, once you open it and you end up using it for something else, it becomes non-sterile then. Okay, you can kind of see a little bit. I know it's kind of hard to see. Once you look, obviously everybody will get one of these at your station to be able to use. So these are the actual thinner ones. So depending on the size of your wound that you have, you can cut them to size because right now they come the full length of this sheet. So you don't need this whole entire strip if you just have a small cut right above your eye or a little bit underneath your chin, wherever it might be. Okay. When you're applying Steri strips, obviously this is something you can use if you're not sending them to stitch or not sending the stitches. What is that length? Like a 1/4 inch? I think your recommendations are usually like a 1/4 inch in length and maybe not an 1/8 of an inch deep or something.
Sounds about right.
About right, that you can put Steri strips. They say anything longer, anything deeper needs to get sent in for stitches because it's going to take longer to heal and the Steri strips aren't going to be able to hold it closed.
And that's the thing. If it opens up, right, that's the size of the scar, right, that's in there. So if you have a gap, right, if you have a gap like, you know, on one of these things here, right, whatever this gap is, that's going to be the size of the scar. So we're trying to decrease the size of the scar as much as possible. And so that's where, you know, good adhesive stuff and all that comes into play.
So, and typically you need a straight laceration if there's anything too jagged in there, or like we saw on the skin where we had like a V or even a Z pattern. Those are going to be even more difficult to try and hold closed with your Steri strips. Those are more than likely going to go and get stitches in because you're not going to be able to hold and pull your skin in 4 different ways to make sure that each and every one of those little gaps are closed up to prevent scar. Just know that even putting Steri strips, you're not guaranteed. I always warn my athletes, you still might get a scar. Most of them are like, I don't care, let me just, throw a Steri strip so I can get back out. When I was in grad school, I did have a cheerleader that took an elbow to the eye, and I said, okay, yep, we probably need to get stitches. And then she started bawling on me, and I was like, well, I can Steri strip it, and you can have a scar. She's like, no. She started crying even more. So depending on your athlete, and I'm not just going towards cheerleaders, but any kind of athlete could have that personality, could have that reaction, and not wanting to have some type of scar. Most athletes that I know are like, yeah, I'm gonna wear that. Give me that scar. I want to, wear it. I'm gonna show it off, whatever. But just warn them, type of thing, that if you Steri strip it, there is a little higher percentage that you might have a scar occurring with it. Okay, like I said, some are like, don't care, throw it on me, let me get back out and playing. So obviously, cut it to length. So when we're cutting, I might just demonstrate this. Am I shown?
Yep, and then I'll move this camera too.
So say, obviously these guys are pretty wide. That's getting a little bit long for what I would do for a Steri strip. I'm probably going to look at these couple guys down here little shorter, I can probably put those together. Even I can take my fingers. Oh yeah, I can hold that pretty good or close together with myself. So I'm going to kind of measure it up. So I'm only going to need a couple of these. Same thing with steri strips too. You want to take gravity away. So if you got a cut underneath your eyebrow, we're going to take the lower skin and try and pull it up. Because otherwise if you're pushing down, then you're just helping gravity along. So you want to try and fight gravity. Same thing when you're on your chin, you want to try and pull it up. If you're anywhere else on the body, putting it on, just kind of go with it and see, well, gravity might affect you this way, but maybe not. So this is my eyebrow, this is my eyes under here, and this is my forehead. So I'm typically going to try to start in the middle. Make sure I hold this area. And then while I'm pulling, and I'm going to stick it. Sorry, these might not stick very well on these gel things.
Ideally, right, so this is mastol, which is a liquid adhesive that you just break. In a pinch, what you can do is just take a few Q-tips or cotton applicator, spray it with your tough skin or whatever, and paint it on. Do not spray the tough skin right into the wound.
Yeah, so you would spray your Q-tip, and then I would rub across the top of it, and I would rub across the bottom of it. Not in the wound, because that's gonna hurt like a bitch. But you want to spray enough on. I like to sit there and spray enough on it, so it's almost like dripping off, so that you know you have some on there. So then, because it's gonna soak into these cotton swabs, right? So you want to get enough on there. Roll on the top, roll on the bottom. That's just gonna give you a little extra adhesiveness on your steri strip. Okay, so typically I start in the middle, and then I'm gonna probably go. I think it says like 3 millimeters in between each of your steri strips. But same thing, then you're gonna pull it. So these aren't gonna stay very well.
It's about the same width as they are on the package. So if you have a bigger one, you could almost,
like I said, you can kind of almost, like I said, if I would just like basically put this on here and pull them, that's about your distance that you want. And then basically you're just gonna put as many on there as you deem necessary, that if it's gonna hold. This one I probably definitely would put then another one on here. Like I said, the gel that doesn't hold very well, but you should have that basically a closed position when you're putting these steri strips on. Okay. If you feel like there's still a little opening, then we're going to cover them again or put some type of non-adherent pad on top of it, wrap it up just so it's protected even further along. Okay. So those are steri strips. Like I said, these are pretty narrow steri strips. If you've got something a little, if you got a little bigger wound, you can take some wider steri strips. The only thing you have is a wide steri strip. You can take it and just cut it down the middle and make your own narrow steri strips. That's what you got.
Butterfly strips are all the same sort of stuff.
Yep. So yeah, butterfly strips, they usually have like the wider ends with a little line in the middle. Because if you're gonna see steri strips on like TV shows, movies, whatever, those are butterfly strips. Okay, so same concept. So okay. So dermal adhesives. So this is if you're lucky enough to get some type of glue. Otherwise, we do keep a lot of super glue. Okay. Technically, you're not supposed to use super glue on your skin, but all of us ATs keep 1 or 2 actual super glue kits in our kits. They're cheap, kind of reusable. As long as they don't dry out, they can usually last probably a whole season. So if I open it up, I use it for somebody, I can usually try and get a couple more uses out of it, depending on how much super glue I have to use. For little cuts, I used it especially on calluses on fingers when you can't really wrap stuff around them and they don't really have a cut. I've used a lot of super glue. But you can super glue on your elbow, you can super glue on your chin, super glue on your fingers. Probably going to burn a little bit if you get it inside the wound, but kind of the same concept. If you're going to use, I don't have one open. So these is obviously, I think you put them on there and it actually pops them open. Take the lid off. I won't glue this. But so you're gonna take the skin, push it together, and then use your super glue. Oh, I got some coming out. Use that super glue basically over the top. Let it dry. You might have to sit there and hold it for a little bit, but try not to get, once again, the super glue into the skin. Okay, and so that's not gonna, I don't even know how well super glue actually will work on this.
We'll find out here in a little bit.
Yeah, so we'll find out. Okay. But yeah, you're probably gonna have to sit there and hold it for a little bit. Careful not to get your finger into the super glue. So that all of a sudden you're pulling away and then it's like, oh, my finger's either stuck to you, I'm pulling away, oh, I opened it up again. So once again, just be very careful with that.
And you're gonna have gloves on, so you gotta practice today wearing your gloves, doing all of this, which makes it just another level.
Be careful where else you drop super glue. Okay, so, yeah, then I can feel it on my hands. Great. Okay, so if you don't have super glue, we also have what's an actual Dermabond. So this is true, like, official skin glue. It's a one-time use though. You open it up. This is like a hard shell, just like your glow sticks. And you gotta shake them a little bit so they get activated. We just crack this area, this little blue gel, you can see floating around in there, then comes out just like a super glue would, but it hardens quickly. So like this whole tube is a one-time use only. Once I crack it, I apply it, and then everything else hardens up inside of it. So we kind of hoard these a little bit, and only like, I don't want to say worst case scenarios, but or dire situations, or like middle of game, and I think they can get you, you know, held back together and I'll put you back out there type of thing. There's just a random practice and I'm like, oh, you don't need to go back in, we're not practicing or playing for anything. I'm not gonna waste my glue on you. But these aren't cheap. We actually get them from the doctor's office, from Dr. Kimber's office. His nurse swipes a couple for us every year. But like I said, each of us carry at least one in our kit. Once we actually do use it, then we, hey, can we get another one so we don't abuse our situation? But if you're lucky enough to be able to have some of this, I say this is kind of like a liquid gold. It works really well. It hardens even quicker than I would think super glue does. So this stuff is actually, yeah, super nice. But I'm not gonna let you play with it. Sorry. Next one is control of bleeding. Okay, so obviously this should go back to your good old first aid CPR days. Control of bleeding, what do we need to do? Apply pressure. Okay, once again, we're gloved up, we're masked up, gowned up, whatever it might be. We're applying pressure using gauze. If we bleed through the gauze, what do we do? Add more gauze on top of it, right? If we're not able to get the bleeding controlled, you can try some pressure point areas, not necessarily going into tourniquet type stuff, but if you can't get that bleeding stopped, then we're going to go ahead and send them in to get elsewise worked on type of thing. Because more than likely they're either too far open that they probably need stitches anyways, or either a massive artery or something is hit that, yeah, we need to get emergency to get that going right away too. So one other thing that we do have, I know I'm trying to move along, is a high temperature cauterizer. So Dr. Boyens had a bunch of these in his clinic. I think they were technically expired, so you can't use them anymore. I personally am never going to use this on a wound because I'll be honest, they make me a little nervous. And I'm sure they do not feel good cauterizing a wound to close up the wound. We got this little green button here. Hold it for a little bit. You might even be able to see there the white hot tip is going on there. Basically, you apply it to the skin and sizzle it and then close up the wound. So, if any of you want to try it, whoever's got the next wound, we'll experiment on you. Or yeah, we can just have an AT branding session, so initiation. Okay.
One pet peeve of mine with that, right? If somebody is bleeding, right? Hand them some gauze, have them put some pressure on it while you put your gloves on, opposed to having them sit there bleeding while you're putting your gloves on. They don't need gloves to put pressure on their own But you see athletic trainers all the time. This person's got blood running down their hand. They're sitting there putting gloves on, and it's just, unless you're really fast at putting gloves on, it's just in there oozing or whatever. Just hand it to them. That way we can all stop seeing the blood.
Okay.
That's just me, though.
Okay, one other use for cauterizer, what we can use it for is actually subfungal hematoma. Who knows what a subfungal hematoma is? Huh?
Use your word roots. Come on, medical term people.
Subfungal hematoma. Yeah.
If you so like if you do the word roots, it's sub and then ungule. But you pronounce it subungule, but it's sub. You could go subungule if you wanted.
Anyone?
So,
So it's blood accumulating underneath of your toenail. So you drop a weight, you kick something, we get runners that have too tight of shoes on, so they get that blood pooling underneath of your toenail. Couple of different options to get that under there. You can heat up your cauterizer and basically melt through the toenail and let it come out, but being very careful that you don't drive through and get the skin. You can also, they have like basically miniature drill bits that you can sit there and you can screw in. You can take a tip of a scalpel and try and screw in, or you can take like if you're doing it at home, you can take like the end of a paper clip, get it super hot, and then drive that into, which is basically the same exact thing as a cauterizer.
And you do need glasses or something on there because that's under pressure. I've seen it hit the ceiling
Yes, I
from
have. Yes,
like because it's under pressure there, and so it goes through this hole. So I've seen it squirt up all the way to the ceiling. So you need glasses or a face shield or something.
So that is a secondary use that you can use a cauterizer for. But all right, so today's kind of practice time. So obviously we have a couple skins that we have some